Hi everyone. Welcome to the first edition of You and Your Health with Rosman Foundation. My name is Akine Solalua Kweli. I'm ambassador of this great foundation. And today we'll be discussing a very important topic, which is hepatitis. We need here I have some important personalities that will be the discussants on today's episode. Ms. Kawilito.
My name is Ragdin Abamson.
My name is Babatunde Karosi.
My name is Elizabeth.
I am Olawumi Segitama.
Okay. So, as I've said earlier, we'll be discussing hepatitis, and I want Ms. Raji to open the floor for us by telling us some things we need to know about this viral infection.
Okay. Hepatitis is an inflammation of the liver that is caused by variety of infectious agents and non-infectious agents. And those non-infectious agents may be consumption of contaminated foods and alcoholics. And also, there are 5 main strains of hepatitis ranging from type A, B, C, D, and E. And with these viruses, they can be fatal and may lead to death. And also, they differ with their mode of transmission, geographical distribution, and prevention and treatment also.
Okay, thank you. From what she has said, she mentioned a very, very important organ in the body, which is the liver. So, Dr. Kamal, please, I want you to tell us what you know about the liver, the functions, and things it does for the body.
Okay, the liver is a very important organ in the body and is very important in metabolism of substances, either food or drugs. Whatever that comes to the body, especially through the mouth, is metabolized in the liver.
So, from what she has said earlier, she mentioned a very important organ in the body, which is the liver. Dr. Kamal, I want you to just enlighten us more on the function of the liver and what the liver does for the body.
The liver is a very important organ in the body. It's mostly involved in metabolism of substances, especially materials that comes in through the gastrointestinal tract. Besides other functions, other functions like metabolism of drugs. Although it's also other functions like the production of bile, conversion of glucose to glycogen and storage, and so on and so forth. But most importantly, the units that perform this function are called hepatocytes, which are the cells of the liver. And when these cells are inflamed, that's when we have a condition that is known as hepatitis, which is inflammation of the liver cells. So the liver cell, which is the basic unit that performs this function, is also the unit that can be affected by inflammation that results in the condition that is known as hepatitis. Now, this inflammation of the liver is so important because mostly it can be caused by various factors, and we have a whole lot of them affecting various categories of people. And it's a very, very common disease. We can agree that it's common. As of 2022, about 3.2% of the world population is infected with hepatitis B. That is about 325 million people worldwide infected with hepatitis B. And we have about 50 million people being infected with hepatitis C. So all in all, we are talking about close to 400 million people being affected worldwide. You see that is a very big concern. Besides other causes, we have the non-alcoholic steatohepatitis, we have the alcoholic hepatitis. So meaning that the numbers can be actually close to 500 million.
Okay, thank you, sir. Ms. Taiwo, what do you think are the main causes of this hepatitis virus?
One of the major causes of hepatitis are the viruses, which are the hepatitis A, B, C, D, and E. Although we have some other causes, another causes is autoimmunity hepatitis. This is when the immune cell is fighting against the liver. And we also have when there is overdosage using of drugs like acetaminophen, misuse of it can lead to hepatitis as well. And also consumption of alcoholic can also lead to hepatitis, and alcoholic consumption also can also lead to hepatitis. And in case of alcoholic, how does this alcohol causes hepatitis is that normally hepatitis is a very toxic substance because it contains some some materials like one of according to what Dr. Kama said, he said one of the function of liver is for metabolism. So when alcohol is being consumed, liver the function of the liver is that it metabolize the alcohol, it breaks down alcohol, it metabolize the alcohol, it breaks down alcohol to acetaldehyde. And this acetaldehyde is a very toxic substance. So from acetaldehyde, it is broken down to acetate. So when this acetaldehyde now mix with this with some protein, liver proteins in the body, it leads to steatohepatocyte. That is, it is due to the consumption of the alcohol that leads to hepatocyte. And if care is not taken, this steatohepatocyte can lead to liver fibrosis, and from liver fibrosis to liver cancer. And when it leads to liver cancer, it eventually leads to death.
And as a matter of fact, majority of the harm that is caused by hepatitis is because it can lead to liver cirrhosis, and then that can progress to hepatocellular carcinoma, and any of these can result into death. So by the time, and that's the most important, that's of great importance. If there is death result, nothing can happen again. And they also have economic importance. For somebody that is affected with liver cirrhosis or hepatocellular carcinoma, definitely you lose man hour and definitely will not be efficient in whatever you're doing. So you can use to the economic importance beside the health importance.
And so, and one of the things is that I'm not saying all people that are taking alcohol will have this liver and that have hepatitis and all that. But it will depend on how our body metabolize this alcohol. So you get so ability, but at least out of 100%, we can still say that 80% of those that take alcohol are liable to have hepatitis.
And there's also one factor about the amount being consumed, because alcoholic hepatitis depends on amount that is consumed and the period of time in which it is consumed. Also, we should also take note of the fact that the way the body metabolizes materials are different. Some people will respond, the way they respond to it is so different. Some will consume a large amount and will also develop, while some will consume a lesser amount in a shorter amount of time and can develop. So although it is a substance that should be consumed with a lot of portion, we don't know the variables that affect them. But an individual consuming alcohol has a tendency to develop alcoholic hepatitis.
Okay, thank you, sir. Miss Grace, please can you tell us the common signs and symptoms of hepatitis virus?
When we talk about signs and symptoms of hepatitis virus, so some are fatigue, dark urine, pale stool, abdominal pain, yellowish skin like jaundice, nausea, vomiting, another ones are
Anorexia nervosa.
anorexia nervosa.
Concerning about diabetes and how like fine, you know, diabetes is also one of the signs and symptoms of liver. How can we identify it in a woman, in an individual? What causes it from the start? One of the things is that normally the lifespan of red blood cells is 120 days. Yes. So after 120 days, this red blood cell, it loses its structure, it loses its function, and it loses its form. So from there, there is a macrophage. There is a macrophage that removes these red blood cells from the circulation, and this macrophage has the lysosomal enzyme that digests the red blood cell and it breaks the hemoglobin. And it breaks this hemoglobin into two parts, which are the M group and the globin group. It is this M group that is now converted to biliverdin, and from biliverdin to bilirubin. And this bilirubin now is being released into the plasma, where the albumin in the plasma take it up and take it to the liver, where the liver metabolize. So inability of the liver to metabolize it will lead to the buildup of bilirubin in the sclera, and in the interstitial space leading to jaundice.
And in some people that are not as dark as we are, they can actually appreciate the bilirubin by seeing it under their skin. It can be seen on the skin, but in dark people, that may not be so. But one thing you should also take note about the signs and symptoms she has mentioned is the fact that most of these signs and symptoms can be mistaken for some other common ailments. For example, we have things like nausea and vomiting, fatigue, and fever. Some of these things may be commonly mistaken for malaria or something close to that, or even pregnancy. Because you say nausea and vomiting most likely, and you are not eating well, probably you are pregnant, or you are having malaria. So sometimes it is actually important to consult a medical practitioner. Whenever you have any symptoms, it may be, God cannot say it can be hepatitis. You are feeling weak and you are feeling tired without, and you cannot eat. So there is need to carry out a medical test to actually know what is wrong. Don't go about with self-diagnosis and self-treatment.
This time, from what you said hepatitis is liver inflammation. So I would like to ask you because from the explanation you said is it can be caused by infectious viruses and non-infectious agents. So can you please mention some of these viruses for us?
According to what you said one of the major causes of viruses, one of the major causes of hepatitis is viruses, and those viruses can be hepatitis A, B, and C, and B, C, D, and E. Aside from that, there are other viruses that can cause hepatitis. We have the cytomegaloviruses, we have the Epstein-Barr virus, and you can say the Epstein-Barr virus is also known as the kissing disease. That's the disease that you contacted through kissing. And aside from Epstein-Barr virus, we also have the yellow fever virus. And aside from yellow fever virus, we also have measles, mumps, and so on.
Okay. So now I want us to start discussing the various types of hepatitis, ranging from type A to type E. So, Miss, oh, so Miss Tyler, from the explanation you gave, you mentioned some viruses that are peculiar to hepatitis, from hepatitis A to hepatitis E. So, what can you tell us about hepatitis A?
Talking about hepatitis A. Hepatitis A is a RNA virus, and it has a tendency to cause an acute illness, but not chronic illness. And one thing we should know is that hepatitis A is being transmitted through fecal-oral routes. And when we say fecal-oral routes, that's through by ingesting contaminated food that has hepatitis A. And one thing we should also know is that there's another virus that is related to hepatitis A in terms of their similarities, in terms of their symptoms. In terms of their symptoms, like hepatitis E now is similar to hepatitis A in terms of transmission. Like hepatitis E can also be transmitted through fecal-oral route, and it also consists of it's also an RNA virus. It's also an RNA virus, and both can be curable even within 6 months. It has a tendency to be it can be cured even without giving treatment to it. It has a tendency to be cured.
So we've been talking about viruses. What does this virus even mean? Virus is an obligate intracellular parasite. That means they become living when they are inside the cell of an host. They are not living outside the cell of an host. They can be lying freely on a doorknob, a table surface, a chair surface, anywhere. But until they get into the host body, that's when they become living. Viruses are particles of nucleic acid, which can either be RNA or DNA. So a viral particle cannot be both. Can never be both. It can never be both RNA or DNA. So it can either be RNA or DNA.
Although one thing I want to correct is the fact that not just inside the host body alone, it must be inside the host cell. It has to take over the host cell metabolism. It can be flowing in the blood and not be effective. It can only be effective if it enters the host cell. And one thing I want to add about hepatitis A and hepatitis E is that among all these viruses, they are the ones that can be prevented with good sanitation practices. If the hygiene is good, they can be prevented because you have to take into your mouth an infected food before you can get hepatitis A and hepatitis E. If the food is clean and is not contaminated with fecal material, an individual cannot be infected with either hepatitis A or hepatitis E.
Thank you, sir. Miss Raji, please can you just tell us what you know about hepatitis B and C?
All right. Hepatitis B is an inflammation of the liver caused by hepatitis B virus. So hepatitis B and C, they are both related in their mode of transmission and in their mode of transmission. So the virus can cause both acute and chronic hepatitis, ranging in severity from mild to a very serious illness, and they can lead to liver cancer, liver cirrhosis, to liver cancer and death. The hepatitis B and C virus is a blood-borne virus. That is, the most infection occur through bodily fluids, semen, or on-screen blood transfusions. And also, the transmission of hepatitis B virus, it occurs in an infected mother to the child during perinatal transmission. And we also have one thing we call horizontal transmission and vertical transmission. So this transmission, the horizontal transmission is exposure to infected blood. And also, hepatitis B virus and C can be contacted through unsafe medical practices, exposure to unsafe sexual practices also. Thank you. Though the treatment for hepatitis B and C virus, they are both the same in the sense that people with hepatitis B and C virus, they can make decisions to visit a liver specialist or to practice to practice safe hygiene.
One thing that we should take note about this viral hepatitis, especially B and C, is the fact that both of them they cause about 1.4 million deaths per year. That's a very great number. And most of these deaths is due to either from liver cirrhosis or from hepatocellular carcinoma. So, and they don't cause those until they become chronic. She mentioned something about the fact that they can either cause an acute disease or a chronic disease. At the stage of being an acute disease, no problem. The person either can recover. But if it progresses to a chronic disease, there is a chance of it resulting into either liver cirrhosis and eventually progress to hepatocellular carcinoma, which is a major cause of death from viral hepatitis.
So also, the current treatment of hepatitis B virus fall into two categories. We have the immune modulator drugs and antiviral medications. So these immune modulator drugs, they help to boost the immune system to get rid of these viruses rather in the body. But these antiviral medications, they are given to that patient to reduce the reproduction of these viruses in the body. But note that hepatitis B virus does not require vaccination but can be cured through antiviral medications.
Okay, talking about vaccinations, um, hepatitis B is the only one among these viruses that can be vaccinated against. There are various vaccination these days. Usually, it used to be that there are like three courses of vaccinations, but now developments are so taking place that even a single dose may be enough to prevent hepatitis B. For hepatitis C, at the moment, there is no vaccination. So what is expected is individual avoid contact with people that are infected. That means not contact, exchange of body fluids with people that are infected. Although there are other what's she can call
So, continuing from where she stopped, the mode of transmission of hepatitis B, which can be unsafe medical practices, reduce neck injuries, tattooing, piercing, especially to affected blood and body fluids such as saliva, menstrual blood, vagina and cellular fluids, and IV drugs too, which are very drugs. So, especially that case, I'll buttress more on that case of saliva parts. So, avoid kissing an infected individual. And if you don't know if it's infected or not, get tested before kissing and stick to your partner.
From what STM Raji said, she said one of the modes of transmission that you can contact this hepatitis B and C is on screen blood transfusion. As an health worker, even before you want to administer a blood to an anemic patient, you should endeavor that the blood that you want to give to the patient has to be a fresh blood, has to be a blood that has been screened, has to be a blood that has been cross-matched. You just don't give blood to patient. Then even as a patient, you have the right to know if the blood you're about to receive has been screened and transfused. So screen and a blood that has been screened and that has been cross-matched has to be given to the patient, not on screen blood.
Now, still on that, as health workers too, you should also take note of incidents of needle stick injury, which are cases in which, by mistake or whatever, there is puncture or pricking of health workers by an infected needle or needle from a patient. So that makes it mandatory that all health workers are supposed to get hepatitis B vaccine. So hepatitis B is very common. So it is better to protect oneself against hepatitis B. So I want to employ all health workers listening to us. They should, if you've not been vaccinated, please be vaccinated.
So, Dr. Pama, she mentioned the use of intravenous drug. So, please, can you tell us what intravenous drug is?
Yeah. The intravenous route as a means of transmitting hepatitis is not a problem that should be encountered when a certified or trained personnel is administering intravenous drug because necessary safety practices will have been carried out. But it's something that we expect with especially drug abusers, people that abuse intravenous drugs, because it's only in such instances that we have um, two or more individuals using the same needle to take in drugs. It's not something you expect with a certified medical practitioner. So it is one of the ways in which hepatitis B can be contacted. And people that abuse drugs, they are also exposed to various other diseases, even besides hepatitis B. They are at risk of contacting other diseases because they're also at risk of other sexually transmitted infections, not not only hepatitis. They are at risk of HIV and many other sexually transmitted diseases.
Okay. Thank you, sir. The infection is a particular type of this virus that we are discussing. It's called the beta agent, which is the hepatitis D virus. And it can only occur in association with hepatitis B virus, which means that hepatitis D virus depends on hepatitis B virus to replicate. And for hepatitis D virus to be prevented, it means that the patient must have been vaccinated for hepatitis B virus. And the mode of transmission.
Okay.
So the mode of transmission is just through blood and body fluids or broken skin, that is from injection and tattooing. So the rate of transmission from mother to child, especially pregnant women, is very very in hepatitis B virus, unlike other types.
So it is said that the combination of HDV and HBV infection is considered the most severe chronic form of viral hepatitis in the sense that because due to more rapid progression, it leads to liver cancer and hepatocellular carcinoma. Thank you. Also, hepatitis D infection can be prevented by hepatitis B immunization, but treatment success are low. Thank you.
Miss Prince, we've been talking about vaccination. So, can you please tell us, is it all the types of hepatitis that can be vaccinated?
Okay, on that point, it's only hepatitis B virus that has a known vaccine for now. Other hepatitis are still unknown. Mm. So, for the vaccination, it's only hepatitis B virus that has a known vaccine for now. Others can only be prevented, like A and E. It can be prevented through normal hygiene. You have to wash your hand before and after eating, even if you just come out from going for a meeting or coming out from a meeting. If you shake anybody, wash your hand. That one is normal hygiene. And cut your nails short, just in case you want to eat anything, cut your nails short. And nails can harbor different kind of virus. So if hepatitis B virus is prevented, if hepatitis B virus is prevented, then it cannot move to D. We can prevent D that way.
Okay. So, we are gradually moving towards the end of this session. But before that, I would like to ask Ms. Tyrone to just give us the general prevention for hepatitis virus.
The general prevention of hepatitis is what we have been saying earlier. Number one thing that you have to maintain good hygiene. That is, out of the good hygiene, it can be personal hygiene, environmental hygiene. And number two is that as an health worker, before you can transfuse a patient, it has to be cross-match and spent. And number three is that for you to prevent hepatitis as a lady who is planning to get married, there are some tests that you need to do, like a marital test. It has to be done before you get wed to your partner. And after getting married, you need to be faithful to your partner. And number three is that you have to avoid sexual intercourse with another person that is not your husband, that is being faithful to your partner.
So we're talking about that number two. I will advise that not only for ladies, but the same thing should be applicable to guys. If it goes one way, it should also go the other way. And then we also have something that we did not talk about on the mode of transmission of hepatitis, which is, I think probably mentioned, but we didn't hammer on it well enough. On the fact that hepatitis can be transmitted through sweat. If somebody that has hepatitis sweats and has contact with the open skin of an uninfected person, that uninfected person can also get infected through that bodily contact. So I think that's a very serious point. And the issue about the kissing, it can only be transmitted if there's a wound in the mouth of the uninfected person. So for those that want to kiss, well, kiss with caution, especially when there is wound in your mouth.
So, in conclusion to this matter, you have to take care of your health and watch what you eat. A good hygiene is better.
Finally, we've come to the end of this session. Like and subscribe to our YouTube channel and also follow us up on our social medias, on our Instagram page, on TikTok, and on Facebook. See, we'll meet next time. Take care of yourself and your health. Love you.